Welcome. Thank you for joining us today. We are very grateful here at Friends Life Care to be teaming up with FITSE for this great webinar. So thank you to FITSE for inviting us, and we're all happy to be here today with Dr. Andy. Dr. Andy is a urogynecologist from the Hospital of the University of Pennsylvania, and she's here to talk about a very important topic, which is bladder health and fitness. We are already tremendously grateful, but even more so because she's sick today, but she's still here and she's going to be using her voice to talk with us. So give her a little grace if she needs to sip some tea or cough or something like that. There is a Q&A box on the bottom of your screen. We encourage you to ask questions throughout, and we will be getting to those questions at the end, as many as we can. At the bottom of the screen as well, you might see 3 dots that say more. And you can click those and you will see the option for closed captioning, or it might say captions. So feel free to turn those on if those are helpful to you. And without further ado, I will pass it over to you, Dr. Andy.
Awesome. I want to make sure you can hear me. Yes, awesome. Well, thank you so much for the opportunity to present today. Again, I apologize. I just came down with a little strep throat, and so my voice sounds a little hoarse, but all good. I think we'll power through it. So we're super excited to team up today to talk about something that's near and dear to my heart, which is bladder fitness after 60. So, this is intended to be, a very sort of introductory discussion about your bladder and bladder health and some things we can do to keep our bladder healthy. In addition, we'll talk a little bit about some research that we're doing here at the University of Pennsylvania if people are interested in getting involved or participating. So without further ado, I will start. So bladder fitness after 60. Let's see. Just want to confirm my slides are advancing.
Oh, I think they came through.
Okay, perfect. Okay, so this is just a basic sort of discussion about the bladder and what it is. Essentially, our bladder is a muscle, right? And it holds urine that you make in the kidney. So I'll have a picture after this one that shows your kidney and where it goes to the bladder. But you make urine in your kidney, and the urine comes down and sits in your bladder, which is a muscle. And so the way it is, while we have this balloons on there, so it starts out like a collapsed balloon, and then as urine fills slowly over a couple of hours, it descends to a full balloon, and ultimately when it's full, it almost looks like a football. A couple of things as we talk about, the bladder is one, because it's a muscle. There are things we can do about it. I know people can feel a little bit hopeless about, oh, my bladder is doing what it wants to do, but it's a muscle, which is a good thing, which means we can train it. The other important thing on this slide is that, to recognize that the bladder fills slowly over 3 to 5 hours, which means that, there are people who tell me I have to go to the bathroom every hour, and I'm running, for most of us, there are clearly exceptions to the rule, our bladder fills slowly at, 3 to 5 hours before it's full. So we should be able to wait that long to go to the bathroom, about 3 to 4 hours before we have to go pee. Here's that picture I said I would show. It shows your kidneys in relation to your bladder. So your kidneys are, in your back, mid-back, and they have this tube, the ureter that brings the urine down to the bladder. It sits in the bladder until you're ready to, pee or go to the bathroom, and then the urethra opens and we pee. I think it's really important to realize that the important differences between men and women, this will, we'll talk about this later, especially when we talk about things like bladder infections and stuff, is that a big thing in this picture is that the urethra is much shorter in women than in men, and that can contribute to some of the conditions we have. So what do these things do? The kidney filters waste and water from your blood. It makes the urine. The urine leaves the kidney through the ureters, enters the bladder. It's a picture of a woman, so you can see the womb there is right behind the bladder. The bladder stores the urine, and then the urine exits the urethra. Again, just sort of basic anatomy. This is what's going on. We'd like to talk about a little bit of a mind over bladder, because the point of this is that your brain can control your bladder, right? And so essentially, your bladder sort of fills with urine. Like we showed in the picture before, it's made in the kidney. It comes down and it sits in the bladder. In order for you to pee or not pee, there's some communication with your brain that allows the bladder to know, hey, I shouldn't be relaxing to pee, or hey, I should be, squeezing so she can pee. But there's this idea that we have control. We have what we call central control over our bladder. And so for most healthy individuals, the brain really is what determines when urine will be passed. So the brain sends a message or a signal telling your muscles to hold the urine, let it out. The nerve sends a signal to the brain telling you, hey, you gotta go, you're full. And then you send signals back that say, okay, good, time to go. So I've used some of these terms already sort of interchangeably. Voiding, urinating, peeing is just really, some people call it passing your water. It's a process that, it sounds like, I always tell people, it sounds so easy, right? We're teaching kids how to do it, but it's actually a pretty complicated process, because in order to pass your water or void or pee, a couple of things have to happen, right? And all of those things are controlled, by the brain. The bladder has to squeeze, the urethra has to relax, and there are these muscles near urethra called the pelvic area that also have to relax in order for you to pee. So these sphincter muscles are right around the urethra, and when you squeeze those, it keeps you from peeing, and then when you relax those, it opens up the urethra and you pee. And so exercises, and some of you might have heard about Kegel exercises, pelvic floor exercises, can really help to strengthen those muscles and prevent leakage. So again, like I said, this stuff is muscles, so it's under our control, and there are things we can do about it. So healthy bladder capacity and habits, this is what I was talking about, is that, you can hold quite a bit of urine in your bladder. When you forget that first sensation to empty your bladder, you're about half full, so about 2 cups in your bladder. But I like to bring this up because I tell people, when you get that first urge, for most people, you still have some time and you can control it before you go to the bathroom. You don't have to run. And, people tell me that every bathroom I see, I stop and I pee. That can sort of get you into this process of actually changing your bladder and making it do things you don't want to do. So your bladder should be able to comfortably hold up to 4 cups. And so a normal sort of like urination habit should be every 3 to 4 hours. And we'll talk about in some women who have overactive bladder or some problems with their bladder, we talk about, trying to lengthen this time of how long it's going to take you to go to the bathroom. But a healthy normal bladder should be able to hold you should only have to void every 3 to 4 hours. So what's urinary incontinence? Incontinence is when a person leaks or loses urine, which can be unexpected. We call it all sorts of things. We say she has an accident, she has a leaky or weak bladder, overactive bladder, I wet myself, I have no control of my bladder. Those are all terms. It basically just means that, you're not able to do all those things I talk about, which is, hold the urine, wait until it's a good time for the bladder to squeeze, for the muscles to relax, for you to pee. This is happening without you being able to control that. So there's some symptoms. I like to just bring up the names here. So urgency is different from urge. We all get an urge to pee, right? You're like, I gotta go, and that's an urge. That's a normal thing. Urgency is when that urge is strong and sudden, and you really feel like you have no time to wait. It starts coming out. So that's urgency. We'll talk about urinary incontinence. Frequency, the other thing we talk about when I, ask women about how often you go into the bathroom. So that's a number there, about 8 times during the day and night. Again, like I said, you should be able to hold the bladder for 3 to 4 hours. So sooner than that is frequency. Nocturia is when we get up at night, our sleep is interrupted because we need to go pee, and bedwetting is when it happens while you're sleeping. So all symptoms that we can get. So why are we here doing this talk and sort of coming to you and having discussions, and then this will sort of go into why we're doing some of the studies we're doing, is that there's this idea that as we get older, we lose control. Oh, this is just what happens. All the girls my age have a low bladder trouble. It just gets worse. I have no control. This is just what's going to happen because I'm older. And I tell patients, yes, incontinence is more common as we get older, but it's not one of those things that's inevitable, right? It's not like, oh, your hair must turn gray, your bladder must fail, So I like to talk about this perception that really it's a perception, right? This is not reality. There are things we can do to help the bladder, and it's not a given fact that as we get older, we have to have bladder trouble. So there are some changes, though. It's a real thing. Age does impact a lot of things, and age impacts our bladder. So what kind of changes happen with the bladder as we get older, which can then contribute to some of this problem? these are the things that we know happens as we get older. You make more urine in the bladder during the night, or when you're laying flat, the bladder holds a little bit less. After you pee, there's a little more left in the bladder than you used to. The bladder can become overactive and you have less time to get to the bathroom. So some of these things do happen as a function of age, but these things don't mean that we have to just accept incontinence as we get older, right? The other reason I go around and do this talk and talk about the bladder is that, incontinence is a problem, and anyone who has incontinence will tell you how much it affects their lives. People don't want to go out, they have to wear pads and diapers, and we'll talk about those things, and it really impacts their lives. But even more, complicated than that is that women and men who have incontinence have a higher risk of falling than those who don't have incontinence. And so, this is why this is such a big problem. This is why we care about it, frankly, right? And people like the National Institute of Aging and people who, do a lot of work with older adults care about incontinence, is that when you have bladder control problems as you're older, it can double the risk of falls, which we know is a really bad thing, right? Falls, can lead to like nursing home admissions. They can lead to like broken bones, and people are not able to do all the things they were doing before. And so in addition to this is a condition that's frustrating and it's annoying and nobody wants to smell like leaking urine, is that this risk where it increases your risk of falls is something that's really important to all of us, and why we really care about making sure that women and men with incontinence get some help with this problem. MoVEonUp, and I'll talk about this later, is a study we're doing to try to actually address this particular problem, because we know that falls doubles in women with incontinence. And so what can we do to reduce that risk in women? So more back to incontinence. So there's certain drugs that can cause or worsen bladder symptoms. Excuse me for a second. Definitely diuretics or water pills. And I'm sure if I could see folks, I'd see folks shaking their head. So, when you gotta get that water off, definitely make sure you run to the bathroom more, and that can make your bladder symptoms worse. There's also some medications, things we take for colds and allergies that can make our bladder worse. Some of the things we take for sleep and anxiety and depression can make it, worse, especially at nighttime. Some of them relax the muscle, which can be problematic and can cause some overactive bladder symptoms. So the point of this is just to tell you that this exists. It's not to say go stop your meds or change your diuretic or anything. Definitely talk to your doctor before you do any changes to your medication. But sort of the understanding that if you're having problems with your bladder, one of the things you should be doing, with your doctor or stuff, is reviewing all the meds you're on and seeing which of those meds could be impacting the bladder symptoms. Sometimes we do some, simple things like taking your diuretic or water pill in the morning instead of in the evening to make sure you get that water up and you're not having the leakage problem at night. So really being cognizant that there are meds that can make the bladder worse is the point of this slide. So how do people cope with bladder problems? They wear pads, they avoid travel and trips, they drink less. So, I was talking to a group of older women a few days ago, and one said how she got herself super dehydrated because she was worried about drinking and leaking, and then had to end up in the emergency room because she was so dehydrated. They don't exercise, people wear dark clothing in case they have an accident, people map where they're going based on is their bathroom, toilet mapping. So, these are things that happen, and these are not normal things, right? These are not. I want you to be able to exercise. I want you to be able to go out with your friends and do things that you want to do and wear whatever clothes you want to wear. And so again, this is our discussion why treatment of incontinence is important, because if people are going through all of these things just to make sure they're not leaking, then we should be doing something to help these women and men. So good toileting habits. This is just sort of in general, what should you be doing? You should empty the bladder in a relaxed and private place. Again, remember, this was like healthy bladder habits and things we should do to make sure our bladder stay healthy. Is that if you're super tense, you may not fully empty your bladder. People squat on the toilet, do all sorts of things. There's that second bullet about just going to the bathroom just in case. That's not a good habit to get into, because what it does, again, your bladder is a muscle, it's trainable. So if you're going just in case, then it gets used to only having small amounts, and then what you can hold ultimately gets smaller. And so what we tell patients is try to go to the bathroom when your bladder is full and you need to go. When you go to the toilet, sit and make sure you empty the bladder. When you wake up in the morning, before you go to bed, I have pictures here, how should we be, what's the right way? It's not squatting, it's not, all the different things that I know sometimes when we're not home, we go into these weird positions. But for women, you really should sit on the toilet, sit, relax your pelvic muscles to pee. Men should stand. If that's hard though, sitting is fine, but making sure you're in these right positions to empty your bladder when you're going is it's a good toileting habit you can form. Water, so drinking, like I said, when I was talking to those women a few days ago, we spent a lot of time talking about water. How much did I drink? How much did I not drink? Oh my God, water. So it's a balance, right? You don't want to drink too much and you don't want to drink too little, right? Because, people with incontinence was telling me, oh, Dr. Andy, I don't drink any water or juice because I'm worried I'm going to wet myself. I don't want to urinate as often. Again, like I said, that might end up with dehydration. That's a bad outcome. We don't want that. What can happen, especially when you don't drink enough, is your urine actually becomes very concentrated, and that can irritate your bladder, and that can cause urgency and frequency and leakage. So you want to drink, right? Drink water every day. Don't drink large amounts at one time. Spread it over the course of the day. Drink when you're thirsty, right? Drink to thirst. There's no need to drink like 8 to 10 bottles of water unless you've been advised that specifically by your doctor. But drink when you're thirsty. Keep yourself hydrated over the course of the day. We'll talk about, nighttime and not drinking too much at nighttime, because especially at night, we want to be careful about how much you're getting up to go to the bathroom, because again, with that discussion about falls being more common, that's when it's more likely to happen. So try to drink it during the day, keep yourself hydrated. Don't drink too much, don't drink too little. Diet and the bladder. So there's certain drinks and foods that can irritate the bladder. So already, if you're having some bladder problems, what kind of things should you be avoiding? The biggest one is caffeine. And when I give this talk, everyone groans and everyone wants to drink their coffee. And I feel so bad telling people, I think you have to be realistic, right? We know that caffeine can irritate the bladder, and so if you're having overactive bladder and having some of these bladder problems, drinking more coffee is just going to make it worse. The tea leaves, just really being careful about whatever you're drinking and looking to see how much caffeine it is. We drink a lot of caffeine. Lots of studies about how much caffeine we consume on a daily basis, and it's mind-boggling. 200 milligrams a day, coffee, tea, soft drinks, lots of things. So just be mindful, especially if you have bladder problems, how much caffeine you're drinking and what's in caffeine. They're adding caffeine to a lot of things. So just be clear about what's in what you're drinking. Artificial sweeteners like equal can be more irritative to the bladder. So of course we balance that with if you have diabetes and what your doctor is telling you. So again, if your doctor is telling you one thing, these are just ideas of things to discuss with your doctor. It's not go home and stop, doing the sweetener that your doctor told you. Instead of being aware that this can irritate the bladder. Things like spicy food and citrusy food, alcohol, all those things can be bladder irritants and can make it more likely that you have urgency, frequency, and leakage. Here's that slide on how to manage the bladder at night. We tell women, stop, don't drink and prop. So stop is, tell women to stop drinking, drink very little after dinner, so you don't have to get up at night to avoid. And so what I like to tell people is that, why are people falling when they have overactive bladder? A lot of times it's not because, there's pee and you're slipping into pee. A lot of people, especially women, what's happening is they're getting up at night. There are no lights in the room. They can't tell that the carpet is a little bit off the floor. They're getting up to go to the bathroom because they feel this urge to go, and they have nocturia, and they slip and they fall. And so anything we can do where we can decrease how much nocturia you have, how many times you're getting up at night to pee, is a good thing. So I usually tell my patients after 6 o'clock, don't drink as much. If you need a little sip to take your meds, that's fine. But try to drink a lot of your water before then, so you have time for that water to come off. Whenever you drink has to come out. Watch those beverages that contain caffeine in the evening or before going to bed. And then this last one about propping your legs. So a lot of you will notice sometimes over the course of the day, near the end of the day, your ankles swell, and what can happen when you go to bed and you lift those up is that fluid can come off, and then now you're making more urine, now you're peeing. And so what we tell patients is, prop those legs up several hours during the afternoon. So like around 2 o'clock or 3 o'clock, go sit in the chair, prop those legs up so that those fluids really come off of you, and you can pee that out before, so it doesn't happen when you actually go to lay down to sleep, and now you're waking up in the middle of sleep, which can be a problem. So stop drinking after dinner. Don't drink things that can irritate your bladder. Remember to prop up your legs. That helps with nighttime symptoms. The other things we talk about a lot is your bowels, keeping the bowels regular. The bowels being out of whack can really make urgency and leakage worse. So we talk about really making sure you're preventing constipation. As you probably know, the older we get, the more constipated we can get. So just being super mindful. We tell patients that we don't want you straining or pushing. If you're having such bad constipation, there are things like, prune juice and things like that can help. But if it's getting to the point where you're pushing and straining, definitely talking to your doctor about what we can put you on to help with that. Warm foods can help the bowels to move. Try to, do it every day at the same time. That can help you sort of get into a habit. But keeping your bowels regular can really be helpful for your bladder as well. This is another thing I mentioned, is that we can train the bladder. It's a muscle, right? So we can train the bladder. Going to the bathroom, and this is what I was saying, is that we want the right sort of amount is that you should be able to go to the bathroom every 3 to 4 hours, right? Every 3 to 4 hours. You don't have to go to the bathroom every hour, unless of course you have an overactive bladder. We need to work towards that. And so the way to get from like every 2 hours or every hour to every 3 to 4 hours is to increase it a little bit every week. So I tell patients that see me, we do what's called bladder training. Okay, this week, try to go 15 or 20 more minutes. So instead of going to pee every hour, try to see if you can go every hour 15, try to see next week you can go every hour 30, and try to teach your bladder to hold a little bit more over time. Because again, going to the bathroom frequently can lead to a fall. So we want to be careful. We talk about controlling urgency by not rushing to the bathroom when you get a strong urge. I tell women, if you get that strong urge, or men also, and you need to go to the bathroom, if you try to run to the bathroom, you are not going to make it. And you could fall, right? Like, it's going to come out because things are moving. Your pelvic floor is moving. It's not contracted. It's doing so if you're getting that strong urge, what I tell patients is pause, stop, take a deep breath, and actually contract your pelvic floor muscles. Squeeze those pelvic floor muscles like a Kegel, or like you're holding back gas. Squeeze it, take a deep breath, try to relax, and then walk to the bathroom. Are you going to have accidents sometimes? Yes, but you're more likely to make it actually to the bathroom when you do it that way, and you're less likely to fall. So responding to those strong urges should not be a let me run. It should be a let me calm down, let me breathe, let me contract my pelvic floor muscle, let me go to the bathroom. So pelvic floor training, again, there's a Kegel exercise, which we tell women to do this all the time. So find the pelvic floor muscles, squeezing them a couple of times a day. Usually I tell people 10 squeezes 3 times a day, or 20 exercises twice a day. Just making sure that you're doing them daily, reminding yourself to just contract those muscles so that those pelvic floor muscles, the ones that I said were right around the urethra, stay strong, so that when you do need to, for them to be strong to hold the urethra, to close off the urethra, they're already strong and can do that. So practice working on untraining your pelvic floor muscle. So I wanted to pause and talk again about that study. So we're doing a study trying to prevent falls in women with urinary incontinence. It's basically we're doing a tailored exercise and bladder training program to see if we improve your physical activity, your bladder control, do we decrease your risk of falls and improve your bladder? We're looking for women who are 70 and older. We do the whole study in the comfort of your own home. The coordinators come out to the house, they do all the forms there. You get randomized to one of 2 groups. Everybody gets a Fitbit. So whatever group you're in, you get a Fitbit, which is nice, and you get to see your steps and how much you're moving. And then so women get the exercise program, a visit from a occupational therapist and bladder training, and the other group gets lots of education information, and we see if this program really does decrease the risk of falls, because that's what we're really hoping for, is that we want your bladder to improve. And clearly, that's why I'm a urogynecologist. I don't want people to have incontinence, but even more so, I really don't want women falling. So can this research study improve the risk of fall? So I think at the end, maybe I'll put there's a website and everything. I'll put that in the chat if anyone is interested. There's information here. You can email us, call us. I'll put the location in the chat. You can check out the website and see if you're interested. Send us a thing there. We'll contact you. So that's incontinence. Other conditions I wanted to talk about today, because I know I have some men and some people who have incontinence. What are the bladder problems that we think about? We want to talk about bladder, benign prostatic hyperplasia, which is only a problem in men. So this is not something that happens in women. And then we'll talk a little bit about UTIs, because that's something that's very common and happens especially as we get older. So BPH, or benign prostatic hyperplasia, is when the prostate gets large. So the prostate is, let me just move to this one. It's like a walnut-sized gland found at the bottom of a man's bladder. It surrounds the urethra, which is a tube where the urine goes through it. And so what can happen is that if that prostate gets really large, it can squeeze the urethra and it can cause some problems in men. As they get older, the prostate does tend to begin to get bigger. That's sort of a natural thing. Clearly, there's like a cutoff. You don't want it too big, because then it'll compress or squeeze the urethra. The urine can be slower, less force, and empty your bladder. The good thing is that it's not cancer, and there are things we can do to help men with this problem. So what kind of symptoms do men get? They go to the bathroom too often, because when they go, they can't empty all the way, especially worse at night, recurrent urgent need to urinate. They feel like they're not empty. Their stream is weak. They're dribbling, leakage, they can get incontinence. So this is just to say, one, this can be a problem. It is definitely a problem that your local urologist can help with. So, if this is happening, if you feel like that process is getting big, you're having enough of this urinary symptoms, again, another thing to talk to your doctor about, and getting a referral to urology to work on things like this. And then finally, just a little discussion on urinary tract infections, which are one of the most common problems we see in doctors' offices, right? If I had $1 for every time I saw a UTI, I'd be a rich lady. But they're very common. They're more common in women, and they're more common, especially as we get older. That has to do with, the loss of estrogen as we get older and things get dry, down in the vagina. The same things happen in the bladder. The tissue gets thin. It's easier for bacteria to stick to the tissue and to cause a UTI. So we tend to see these more commonly in women as they get older. It's caused by bacteria in the urine. So the bacteria can go, usually bacteria that's sitting around that pelvic area or the rectum. It climbs into the vagina and then climbs to the bladder, and you get a UTI. Again, it's more common, like I mentioned, in women, because remember that picture at the beginning where I said our urethra is very short compared to men. So everything is really close down there. So it's easier for that bacteria to get from one area to another and cause this UTI. So that's why we're more likely to get them. Symptoms that people can get: fever, going to the bathroom more frequently, urgency frequency, difficulty urinating, pain in the back, low back pain, nausea, smelly urine. The one thing I wanted to talk about, though, to this group is that a lot of times, especially in older patients, we don't see this classic symptoms, right? So sometimes people are like, they're not having a fever, it's not burning when I pee, A lot of times, especially as we get older, one of the symptoms we see, especially in women, is confusion, actually. So, a daughter will come and say, I don't know, mom's just been acting a little off, and she's not herself, and I'm just not sure. And 9 out of 10 times she has a UTI that's sort of causing that. So just be mindful as we get older, some of those symptoms, some of you that have had UTIs when you were younger might remember the burning and the pain and all of that you had, is that as we get older, you don't get a lot of those symptoms might change. And so it could still be a UTI. It's still really important to go to get checked, to get a urine culture to see if something's going on and to treat it appropriately. So just a highlight of UTIs in older adults. How do we treat it? Like I said, there's medication, mostly antibiotics we give women. People talk about cranberry juice and cranberry supplements that can help. I do tell patients, if you're going to do cranberry juice, don't drink the one that has all that sugar in it. Make sure, you're drinking the one that doesn't taste great and it's really concentrated cranberry, not sugary water. But that can help. Lots of water. So when you have a UTI, that's another time that your doctor might tell you, hey, I know you might be leaking, but I really need you to flush this thing out. So you may need to drink a lot of water when you're having a UTI. Prevention, these are things I tell patients. Most of us know about this by the time we get to our age, is that you should wipe from front to back after a bowel movement. Again, like I said, that bacteria is sitting in the rectum. We don't want to get it close to that urethra and get into the bladder and cause a UTI. We tell patients, don't use any weird perfumes and powders down there. It can irritate your skin. It can make it more likely that these, bacteria will stick and you can get a UTI. And if you're seeing any weird rashes, itching, discharge, just, call the doctor, get it checked out. but really being careful about, all you need for that area is really just water to wash it up. There's no douching. There's nothing that we need to do. All those things increase your risk. The other things, when you go see your doctor, sometimes they'll send you to someone like me, a urogynecologist. There prevention medicines, there's estrogen cream, there are lots of things we can do to try to prevent this problem. So making sure you get that checked out. So I think we're nearing the end here. I think the point of this is that good habits can stop bladder symptoms and can help us improve bladder control. So, being aware of things to do for your bladder to help it, not leak, empty appropriately. If you're worried about your symptoms, obviously contact your primary care doc, to discuss treatments. They might give you some, they might send you to a urologist or urogynecologist. There are people whose whole job is to take care of this. So I think a lot of the announcements really, I don't want people just living with this and just saying, hey, this is what I got to do. I got to just leak and deal with this problem. There's a lot of things we can do. So make sure you see someone. And this is just, about that MoVEonUp study. And then plus is another study that's funded by the NIDDK. These are the people that give us money to do all these talks and do this research. So I think that is the end of the slides for me. I think should I stop sharing?
No, I think you can leave that up in case people are interested. Maybe they can.
It does have the website. Good. Okay.
That would be great. I did see a question about recording, and I'm going to put that in the chat where you can find that. That will be available in about 48 to 72 hours. If you don't see that in the chat, if you could let me know in the Q&A box. But I want to give time for people to put questions in the Q&A box. And while we wait for those, I hope you'll have some tea for your throat, Dr. Andy, while we wait. And I want to again thank Fitzy for inviting us to be a part here for this presentation. So while we are waiting for some questions, I really wanted to comment on what you said, which is this is not something that has to happen as we get older. And I appreciate you saying that, because I think that's something that we're all many of us are told. And so it was refreshing to hear that.
I agree. And, I think that's a big message I tell patients all the time. You don't have to leak it, it's not a given that we all have to go out and buy this diapers and pads. There are a lot of things we can do. And, people get worried, oh, you're going to try to do surgery on me. I think I'm too old for surgery. There's non-surgical treatments. There's lots of different treatments. And then, something like that study we're doing really is a home-based exercise and bladder training program. You don't have to come into the hospital. So there are lots of things we can do to help these conditions.
I'm sorry if I missed it, but did you speak about Kegels and if they're Kegels or efficacy about those?
Yeah, no, I think I said it in passing. So Kegel exercises are when you contract those pelvic floor muscles that I showed that go across the urethra. And people was like, how do I do that? How do I know I'm doing them right? So the example I always tell patients is, imagine you're in an elevator and gas is about to come out of your bottom. You're like, oh my God, I gotta hold this gas back. The muscle it takes to do that, to hold that, to squeeze around that, is essentially doing a Kegel. So if you think about that, or the other thing people say is, while you're peeing, try to cut stop the flow of urine by squeezing. The muscle is taken to do that is doing a Kegel exercise. So that's how to make sure you're doing them appropriately. And we tell patients, do them daily. My usual thing is do 10 of them 3 times a day, because people tend to peg them to breakfast, lunch, and dinner or something, 20 of them twice a day. As long as you're doing them honestly, it just helps to keep those muscles strong.
Thank you. Admittedly, I'm a social worker by background, so this question, I am probably going to butcher these medications. But the question is, can you talk about the pros and cons of medications such as Merberic, Gemtesa, etc.?
Yeah, that's such a good question. So these are medicines that we use for patients who have overactive bladder or incontinence. And there's quite a few different meds that we use. Again, I will preface this by saying that this does not constitute medical advice. I cannot tell you what medicine to take or not to take. That has to be done with your personal doctor talking to you about it. So we all know that, and we preface that. Don't go home and take some medicine because Dr. Andy said so. But these are meds that help with just calming the bladder down. And so Mebetric is one. There They help with like the overactive, the frequency, urgency, the running to the bathroom, like giving you a little more time to make it to the bathroom. They have different side effects. It's the biggest thing with Metric versus Gemtesa. And it is just, Gemtesa is a little bit newer to the market. It can have some issues, run into some issues with getting insurance companies to cover it, which is always a fun thing I have to deal with, is which one will they cover, which one is on your insurance plan. But they all sort of work the same, and it has to do a little bit with the different side effect profile. So one big thing is with the Med background, we want to be really careful about using it in people who have high blood pressure. So if you have that, your doctor might say that's not a good idea for you. So but these are all medicines to help with overactive bladder.
Thank you. Another question came in. If you know that you're going to be riding in a car for 3+ hours, isn't it prudent to go to the bathroom one more time before getting in the car?
Yeah, I mean, I'm not gonna tell people not to go to the bathroom, right? If I'm gonna be there 3 to 4 hours, you're not gonna be able to go. Yeah, I think you should go every 3 hours. So if you know you haven't taken a ride, I would go. I would try to empty your bladder completely before you get in the car, so you don't have to stop on the road. So, I think that's not, I think what I was referring to about going all the time is every time I see a bathroom, I gotta go because I don't know when the next bathroom is gonna show up. You get yourself into this cycle of just going to the bathroom all the time, and then you're going every 30 minutes, every hour. And that's just training your bladder to not hold enough urine, right? Your bladder's like, oh, I don't need to hold that much. I can get a little bit smaller. And so just being mindful of how frequent you're going, I think was the point of that. But absolutely, I don't want people leaking. If you're going to go on a long ride, please go to the bathroom,
That's good advice. Another question, what is the current thinking and research regarding acupuncture and bladder control?
Oh, that's a great question. I think I don't know a lot about traditional acupuncture. What they might be referring to is a treatment called percutaneous tibial nerve stimulation, where we place an acupuncture type needle in the tibial nerve, and that's a treatment for overactive bladder and urgent incontinence. So I don't know if that's what they're referring to, but that's certainly a treatment that we use. It has to be a little bit more involved, so you have to come weekly for like 12 weeks. So there's pros and cons to both. But as far as traditional sort of acupuncture outside of that, I'm not aware of the data there.
Thank you. Is there a difference in bladder capacity between men and women?
That's a great question. I think there is. They're not big differences. And they change with age. So we tend to say it's mostly sort of within a wide range of normal. It's all the same, what happens is it gets a little smaller as we get older in everyone. So that's what to know, but it's not hugely different.
Doesn't this group always have the best questions?
They're so amazing. Cool. I love these questions.
I think as much as I always love the presentations, I always hope people stay for the questions because they're so good. Another question, are there any foods which are especially good for the bladder? I was recently diagnosed with bladder cancer. It was not embedded in the bladder wall, so there is no treatment recommended. What about saw palmetto?
Excellent question. I'm going to plead the fifth on that one. I think we always sort of have to be a little bit careful, right? When we talk about treatments for these things, I am bound by things that are FDA approved and things that the government has done a lot of studies on. So my understanding is that there's not a lot of studies in those areas, but I'm definitely not nutrition is not my background. There are people who do this specifically and have a lot more information. So I'm going to say I don't know there.
Yeah, sure. Is there anything to help with leakage when sneezing?
Absolutely, yes. So leakage when sneezing is what we call stress incontinence. You'll say every time I sneeze or jump or cough, I leak some urine, and that really does have to do with supports of the urethra. So if that's your bladder, I don't know if people can see my hand. Your bladder and your urethra is that tube. The ligaments that sit underneath that tube to support it. And so if those ligaments get weak, you can leak when you sneeze or cough or jump. And there's lots of treatments. Exercises help there. There's what we call an incontinence ring, a little plastic ring that we can put underneath the urethra to support it. There is a sling, which is a surgery. We can go put a little sling underneath the urethra. The injections we can do to close up the urethra a little bit. Lots and lots of treatment options. So if that's happening, please go see someone. There's lots we can do to help with that.
Great. This question, I think you explained it a little more, so hopefully you got your answer, but it was about how explicitly to do the Kegels, and Dr. Andy talked about being in an elevator and feeling like you have to hold in gas and that.
Yeah.
So I hope that answered your question, Karen. The next question, when I sit for a while, usually at my computer, I don't feel a need to urinate until I stand up, and then it's sudden and I need to rush to the bathroom. Is that common?
So yes, I feel an issue when I stand up and then it's sudden. Yeah, that can happen. And that usually is related to urgent incontinence. Is I don't, oh, I'm doing okay while I'm sitting. The minute I go to stand up, things are moving around, you're sensing it more. Again, that's a time that I don't know who asked that question, where do not run to the bathroom. Just take a pause, squeeze those pelvic floor muscles, and then walk to the bathroom. You're more likely to make it that way than trying to beeline for the bathroom. But yes, that is actually a common symptom.
This is kind of a jokey comment, but I agree. No caffeine, spicy foods, citrus, alcohol. You've ruined my life.
Oh, right. I apologize. I always tell people I'm so sorry. I don't mean to be like, the Grinch who stole Christmas. I mean, everything in moderation, right? Maybe drink 1 cup instead of 2 cups. Yes, I agree. Like all the good things. But I think, I'm really talking about the women who are like, this is really impacting their life, right? Then typically we're ready to try to do something to help it. But if you're like, I leak a little bit, but my coffee really makes me happy. I'm also like, you gotta be happy.
I get that balance, right? The next question, do you know whether mechanical devices that are inserted in the vagina are helpful?
Oh, that's a great question. So there are lots of different mechanical. I'm not sure which one he or she's referring to. There are a lot of different mechanical devices that can be inserted. So they might be talking about devices that we use sometimes when we're doing pelvic floor exercises, where you're with a physical therapist and they're working and helping you do biofeedback. So yeah, those help, and they help you sort of know what you're doing. Or they might be referring to like an incontinence ring or a pessary that helps with stress incontinence. That's also helpful. So I don't know which one, but yes, they're helpful. They can be helpful. I do worry sometimes people go and buy all these things online. I just would be careful. There's lots of snake oil out there. Some of those things you buy and balls to put in your vagina, honestly, just do a Kegel exercise. You're doing the same thing. You don't need to spend lots of money on that. A lot of us are on fixed incomes. I would just be careful about that. If it's something that you're seeing either a trained physical therapist or a physician or a nurse practitioner, someone that's, treating you for something, that's a different thing. But just be careful about a lot of random things out on the market to buy online. I don't know that those always help.
And I think that can't be understated, the benefit of pelvic floor therapy as an option too. Talk to your doctor, get a therapist, all those things. Very helpful.
It's amazing. Yeah.
We had a follow-up. So the explanation about the Kegels, I guess, could you give a deeper explanation of how to do them?
Okay. So, I mean, I guess what I was trying to say is I said 3 times a day, do 10 of them. So like everyone could be doing a Kegel right now. So why don't we practice? So squeeze the muscle, like figure out, think about where your urethra is and squeeze the muscle around it. Squeeze the muscle you would squeeze to hold back gas, and hold it for like 5-10 seconds and release. That's a Kegel. That's what I'm talking about. So doing those squeeze and hold for 5 to 10 seconds, release 10 of those, and you do them in the morning, midday, and at night. It's just a way to remember. You can do 20 at once and 20. That matters less. It's just being consistent about doing them, but holding them and that you can extend how long you hold them for. So the first time you do it, you're like, oh my God, I only held that for 2 seconds, and then I had to relax. You'll notice over time that it'll become 5 seconds, 10 seconds. There's more time. So that's what I mean by that.
Talk about a bonding experience, or all. Okay. Can you talk about other causes of urinary problems, such as pelvic organ prolapse or hypertonic overactive pelvic floor muscles? How might treatments differ, such as incorporating reverse Kegels, squatty potties, etc.?
Oh my goodness, great question. Was that Avery? Yes.
Yeah.
You can go on for hours. Avery, you want to be on this talk for the next 5 hours. I'm a urogynecologist. This is what I do, right? I could go on and on about prolapse and all sorts of things. Yes, all those things can contribute to incontinence. Prolapse tends to be, the risk factors, the things that make you more likely to have incontinence also increase your risk of prolapse. And so they tend to co-occur. And so, the big thing is when a patient comes to see me with prolapse, I always assess for incontinence. What I don't want to do is treat your prolapse with either pessary or surgery, and then you have like incontinence. That's worse, right? People get really angry. So we look at that together. Reverse Kegels, I think some of that would, the reverse Kegels and things like that, I do defer to my PT, my physical therapy colleagues, because listen, I tell my patients, they are doctors in their own right. They spend a lot of time thinking about the muscles down there. They have specialized training. You want to go to a physical therapist who's a women's health trained physical therapist, because they have a lot of expertise there. And I mean, the things they can do, I could never even talk about. So going to them, sometimes they'll do different Kegels for that. I think one of the things maybe like the hypertonic pelvic floor muscle, we want to be careful about actually contracting on those. Sometimes they'll get you, they're trying to teach you to relax instead. So maybe that's where she's headed. But yeah, that's stuff that, you know, you go see a PT and they really help you assess that.
Thank you. Can the use of estrogen cream help with prevention of UTIs?
100%. It's one of my favorite things to do. Yes, I you know, within reason, I tell most of my older patients should be on some vaginal estrogen. Of course, there's caveats to that. Again, you know, this does not constitute medical advice, but I would say most older women should be on a little bit of vaginal estrogen. And we usually have a long discussion about that. And that really does help prevent urinary tract infections. Yes.
Thank you. 2 questions from this person here. The first, should men do Kegels also?
That's a great question. I certainly wouldn't be bad. I'm not a urologist, so the disclosures I never see men. I only see women. I don't think it'd be bad to do some Kegels, but again, if you're leaking, I would definitely go see a urologist. That's sort of their thing, and they have a lot of expertise in that.
Okay, thank you. And does prostate cancer in men lead to leaky bladder?
That's a good question. I think some of the treatments can be associated with incontinence. So yeah, you know, one of the things we're really cognizant of, right, and both in men and women, is that we used to think, oh, you have cancer, let's do everything to get rid of the cancer, but then, you know, what's the quality of life you leave a person with? And so there's actually there's a lot more work now into saying what kind of like coexisting like quality of life issues or patients with cancers have, and how can we help them? So actually, not on the men's side, but on the women's side, I see a lot of my colleagues, patients who see our oncologists here for like a uterine or ovarian cancer, and they happen to have some leakage or they have some prolapse, and we try to work together because yes, you want to get rid of the cancer, you want to live from the cancer, but also don't want to, you know, you want to try to improve people's quality of life while you're doing that. So yes, it can increase, but there's a lot of attention to that. And so that's definitely something to bring up with the urologist.
Thank you. We're going to answer, guess 2 more. And the next one here is, what's the difference between a Kegel exercise and an exercise to strengthen the gluteus maximus?
Great question. I have no idea. That's the truth. I think that's where I rely on my physical therapy colleagues. They know all the stuff they do with muscles is always mind blowing to me. I've actually decided I'm going to go see a PT and do some PT sessions, but I don't know. It's a short answer.
And who knows? Maybe we're doing both when we're doing.
Yeah, there we go.
You know, that would be great. Okay, I'm going to answer one more question here. What is the ointment older women should use to prevent UTIs?
It's vaginal estrogen cream. It's not something you can buy yourself. That's something you have to be prescribed. It's prescription only. So you have to talk to your doctor about it.
Okay.
It's a prescription.
Thank you so much. We really appreciate you being here with us, even though you're sick.
This was amazing. What a group.
Yeah, it's such a good group. And I want to let everyone on the call know, we hope that you come next month, May 19th. We have a double board certified neurologist, psychiatrist talking about hope on the horizon for Alzheimer's. So if you, like me, have been confused with all the updates coming out, you're not gonna want to miss that, and we hope to see you there. Thank you so much, Dr. Andy, for being here with us today, and
it was my pleasure
for joining us.
Thank you so much. It really was my pleasure. Thank you.
Bye-bye.
Bye-bye.